Well, Dr. Torch, thank you very much for the introduction, and it is a pleasure to be here this morning. A quick trip up last night from Atlanta, Georgia, my permanent home. It was kind of nice and a good flight and a good Uber ride from the airport to Capitol Hill, and I'm getting used to that now after this being my third year with the district policy group. And as Dr. Torch mentioned, our group, my colleague, I should say, Senior Vice President Jeremy Scott, standing there in the back of the room, represents our client, Prevent Blindness. So that's why I was invited to be here this morning. And we have a lot of clients. The district policy group represents a number of healthcare related organizations, mostly nonprofit. And so when I see my colleagues back home, most retired and enjoying the golf course 3 or 4 days a week, and they ask me what I'm doing, I say, hey, I'm right in my lane, I'm right in my space, I'm doing healthcare. I'm just not voting. I don't have to carry around that voting card and go to those town hall meetings and get rotten tomatoes thrown at me, which is kind of nice too. But thank you, Dr. Torch, as I said, for the introduction, and thanks to the National Academy of Sciences, Engineering, and Medicine for giving me the opportunity to speak to you this morning. Hugely important, that is prioritizing eye health. I am absolutely not the expert. You are the experts, and I recognize that. But I did want to maybe give you a little bit different perspective, and the perspective from a physician and former member of Congress, which is somewhat unique, although we're growing in numbers every Congress. I spent 12 years representing Georgia's 11th Congressional District. That's northwest of Atlanta. And as you know, each congressional district is 700,000 people. They don't all vote for you, but I manage to usually in that conservative Republican district get about 60% of the vote. I joke a little bit, and others with me, that when I was first campaigning, I said on the entire campaign time, as I was beating the pavement and going to all these meetings and everything, that, I delivered 5,200 babies. And you know, by golly, I ended up winning that election by about 5,200 votes. Some of them were 3 and 4 years old, and I really appreciate their parents taking them out to the polls that year. I served on a lot of committees, as Dr. Torch mentioned. Energy and commerce, of course, is where the action really was for me in regard to healthcare and all of the things that I'm doing now as well. But in the Congress, it's tough to get the committee that you really need to be on when you first get there, because they're exclusive. Ways and Means and Energy and Commerce and appropriations. They're Republicans, they're Democrats, and they're appropriators. Of course, that was all before earmarks went away. But it took me 6 years to get on the Energy and Commerce Committee and to really kind of focus on the things that I mainly wanted to focus on. But the entire experience was great. I did join the Vision Caucus, and I believe my co-chair at that time is still a very senior member now, and committee chair, Ileana Ross-Layton from the great state of Florida. Just saw her last week. A wonderful, wonderful person. And I think I joined the organization in 2003. It's a bipartisan coalition and dedicated, as you know, to raising awareness about vision loss and prevention and advocating for policies that ensure resources are directed toward research, prevention, and treatment of eye disease. Now, you know, I would love to stand here and say, everything looks great, man, the money's flowing in, and this weekend, and I try to do this every weekend, is to tape the morning shows, the Sunday morning shows. I can't stand commercials anymore. I'm getting to that point in my life where they just annoy the heck out of me. So I tape them all, and then in the evening I try to watch these shows. And Mick Mulvaney, the OMB director, was one of the guests, and you know, they're talking about putting 53 more billions of dollars into the Department of Defense to overcome 2 or 3 years of sequester, when really sequester probably was done for the right reason. And now, of course, all the brass are telling President Trump, you know, we're underfunded, we're unprepared, we don't have readiness, we could not possibly fight 2 wars at one time, and so the emphasis is going to be on beefing up their budget. But after all, it's part of the budget, not the mandatory, but the discretionary budget, which is only a third of the entirety of the budget. But military takes up 50% of that third. And so when you boost them up about $50 billion, what happens to everything that you in this room are appropriately concerned about? I want to tell you how I got really started in this and why my focus on preventing blindness and limited vision and visual screening at an early age. We have, my wife and I think we've been married 46 years, but it might be 47. I can get away with that because she's not here today. She is here, living and well, but we have 13 grandchildren, 4 kids, adults, and 13 grandchildren. Well, the oldest are now 19 years old, and they are identical twins. And they were born at 26 weeks, just short of 26 weeks. So they were not just premature. They were what we know, and you know, as immature. Prematurity, if it's below a certain birth weight or gestational weeks of 37 weeks, I believe, is the definition of prematurity, unless they've changed that one on me too in the years since I've practiced obstetrics and gynecology. But immaturity, 25 and a half weeks and 1 pound 12 ounces, that's immaturity. And my granddaughters, our granddaughters, remained in the intensive care nursery for 80 days. And, you know, you could hold them in the palm of your hand, one in each hand. And we worried that they would not survive. We worried that they would survive and that they would both be damaged. Think cerebral palsy and all the other things that go along with immaturity. And then we worried that one would and one wouldn't. You know, we had all these concerns, and as it turned out, we were so blessed. And even to this day, 19 years later, as they're about to go off to college, we think, God, you granted us 2 miracles. And that's pretty bold to ask for 2 miracles, not 1, but 2, and we got them both. One of the granddaughters, though, did have some visual problems. She had more oxygen therapy, and maybe that was because of a little brain bleed. And the intensive care nurseries and the nurses are fabulous. You talk about angels and heroes. But checking them every day, and so the one did require more oxygen, and so her vision has been impaired, but not so badly. I mean, one eye pretty bad, but the other eye okay, and she does very well with a contact lens, and that started probably at age 5, and lots of laser surgeries, and who knows what the future will hold, but that's the only impairment. Can you imagine that? Just think about it. And so we are very grateful, but it certainly, when I got to Congress and I had an opportunity to get involved with the Vision Caucus, And then when I got to Drinker, Biddle, Reith, and the district policy group and realized that one of the clients was prevent blindness, I was thrilled in a way to kind of join Jeremy and working with the client and getting more up to speed as I continue to do and will continue to do. Of course, we all know why we're gathered here today. Blindness and vision loss, in fact, certainly not just my granddaughter and the minimal effect, as I mentioned, but people of all ages in the United States. It has a large economic and quality of life impact than most people realize. The National Academies, we're here today in this beautiful building. The National Academies of Science, Engineering, and Medicine estimates that 6.42 million people, 6.42 million people have uncorrectable vision impairment in the United States, and that 142 million adults, that's more than the number that get their health insurance through their corporations. I learned that this past weekend too. 142 million adults over the age of 40 experience vision problems. In 2013, at NORC, at the University of Chicago, they did a study and they estimated that eye disorders and vision loss impose a $139 billion economic burden on the United States economy. And NRRC is a very well-respected organization, and their numbers are not fake news, not funny numbers. They're spot on. And NRRC says of this, $47.4 billion is a direct cost to the government and to we the taxpayer, including direct costs and then obviously long-term care, which people often forget about. These statistics are not new to all of you, nor is the fact that outside of the $715.9 million being spent on biomedical research at the National Institute, the federal government is only spending $3.8 million on the prevention of eye disease in this country. $3.8 million compared to $715 million. I don't know what that percentage is, but you do the math. It's quite low. In order to reduce those statistics and boost vision health I just mentioned, Congress needs to significantly increase the amount of money that they invest on vision and eye health programs across the federal agencies within the Department of Health and Human Services. Yes, Dr. Tom Price is a friend of mine, orthopedic surgeon in Northwest Atlanta, my neighbor. His wife also is a physician, anesthesiologist, and put to sleep a number of patients that I operated on. She's retired from the practice of medicine, but Tom is a great choice. I know people have concerns, and a lot of folks worried about the Affordable Care Act, and a lot of very important organizations opposed to repeal and replace. And but I think in the long run, and I do think we need to think not just what's going to happen between now and the Easter recess, but 2 to 3, 5 years from now, I think if some of these changes are made, maybe not all of them, that we're going to be better off. I really, truly believe his leadership is going to stand out. So, standing here this morning, I can't paint you a rosy picture about the outlook of the budget, as I've mentioned. And you're aware, my former colleagues on the Hill, they're still working on the fiscal 2017 budget. And I think it's, Jeremy, April the 28th that the CR ends, and then, there'll probably be another CR to the end of the year, to the end of the fiscal year, the end of September, because they have got to get started on FY 2018 budget. I mean, they're already late. They're always historically late, but this is late. So I predict that's what will happen with the 2017, just a rubber stamp CR. I don't know whether many changes, and then what will happen in 2018, of course, is where the battle will be. The current continuing resolution, it funds everything, as I said, up to April 28th, and sometime between now and then, they'll have to either pass the remaining appropriations bills. They're not going to do that. They're not, if they did it in the House, they wouldn't do it in the Senate. So that's why I say it'll just be a CR to get past that and to start working on the 2018 budget. So here's what we know today. President Trump is proposing a significant increase in funding for the Department of Defense, which will cause a cut in spending for other domestic programs, including domestic health programs. In the next few days, President Trump's going to release an outline of his, Wednesday, right? The 15th? An outline of his budget priorities, and this is what I was mentioning in regard to listening to the OMB chief, newly appointed Mick Mulvaney from South Carolina. And I know him pretty well, not as well as I know Tom Price, but I know him pretty well. And he's accessible. I think I can get to talk to him. If you guys write some things down on some sheets of paper, maybe we can get to talk to him a little bit as we go along. But we're going to find out pretty soon what their blueprint is. And remember, though, of course, they propose, the executive branch proposes, but the legislative branch disposes. So it's just a blueprint. And what the Congress does in regard to the authorizing committees and those committee chairs and what the appropriators do, that's where the rubber meets the road. It's that's what they'll try to go along with Trump as much as they can, but certainly they're not going to allow discretionary spending other than military to be cut to the bone. I mean, there just would be too much opposition to that in too many congressional districts, whether they're Republican or Democrat, House or Senate. So again, don't panic. Like my minister said, I think it was last week in giving his homily, he said, it's okay with God if you are concerned about things, but it's not okay to worry, to fret, to have no confidence and no faith. And I think that's a good point to remember, because I think we all tend to get all tied up in knots worrying about things rather than being concerned and making plans in a logical, intelligent way, and always thinking this glass is half full, it's not half empty. And we're going to figure out a way. Even if we have to take a haircut, we're going to figure out a way. Members of both the House and Senate have said that while they support an increase in the spending for the Department of Defense, they do not want it to come at the expense of discretionary health spending. It will be very interesting to watch how this all plays out. It could ultimately mean level funding or worse, further cuts to our programs at the CDC. God, I hope not. Again, I'm not going to worry, but I am concerned. And I want to do everything I can to see that doesn't happen. The CDC, Dr. Torch spent 21 years, I think, at the CDC. And I've spent 74 minus 18, a lot of years living in Atlanta, Georgia, where the CDC is even more important than the Atlanta Braves. But it's close, of course. We love our Braves. Another challenge that we face is a very real prospect of the elimination of the Prevention and Public Health Fund at the CDC. Now, this is almost causes me to worry and not just be concerned, because this program was created by Congress when the Affordable Care Act passed in 2010, March 2010, as mandatory spending, and it currently, I didn't realize this until Jeremy pointed it out to me, it currently makes up 12% of the CDC's programmatic spending. 12%. This has never been popular, believe me, and not with Mick Mulvaney in particular. With my Republican colleagues, it's been a target for elimination in the bill that passed the last Congress, as you know, last year, but was vetoed by President Obama. Last week, the House held hearings on the American Health Care Act, the bill that would repeal and replace the Affordable Care Act, or Obamacare. I bring this up this morning because if this bill would, in fact, eliminate the prevention fund, that 12%, it would eliminate that. This shortfall on top of the president's budget could mean cuts to all of the programs at the CDC. The good news is that last year, the National Academies issued their report on vision loss, making eye health a population health imperative, Vision for Tomorrow. And this report lays out a great roadmap for addressing correctable and avoidable vision impairment. The report recommends, and I agree, that the U.S. Department of Health and Human Services and the CDC develop more coordinated programs with other federal agencies, professional organizations, researchers, and all other stakeholders to eliminate correctable and avoidable vision impairment by 2030. That's the goal. Having all of the key players at the same table will be essential. As a result of this collaboration, the CDC and Health and Human Services should convene task forces and work groups to develop a research agenda so that there is more information and evidence that can guide policy decisions around vision impairment. As you know, there is currently no single set of evidence-based clinical and rehab practice guidelines that are universally used for prevention, screening, monitoring, and diagnosis of eye and vision problems. Having agreed upon guidelines is not only important to improve treatment, but to help determine payment policies. That's what we've been talking about here mainly this morning, including coverage determination for corrective lenses and visual assisted devices. Another recommendation I'd like to highlight is the community health needs assessments conducted by health departments and healthcare systems. These assessments are necessary to identify barriers to vision-related services and find ways to improve access to comprehensive eye exams, screenings, and follow-up services. Lastly, if Congress would provide CDC with more support, the agency could expand its vision grant programs for such initiatives, including awareness programs on eye injuries to reduce such accidents. This report provides Congress with everything they need up front to improve vision, health, and care. We will continue to do our jobs as stakeholders to ensure they prioritize this. As I close, I want to just say again, our family, my family, feels so blessed that my granddaughter received the treatment that she needed to maintain her vision. By improving the national framework for how we study and address vision loss issues, we can ensure that everyone in our country has access to the treatment and care they need to lead healthy and productive lives. I think as I realize that a lot more money is going to the Department of Defense, $50 billion more. And then I think about, you know, how much does it cost to build and produce and to airborne a Joint Strike Fighter? Or how much does one more littoral ship cost? And how much does it cost to put 20,000 more Customs and Border Patrol agents on our southern border, maybe a yard apart, holding hands? If just one of them had impaired vision or possibly was blind, that'd be a pretty good crossing point for illegal immigrants, wouldn't it? Maybe that's a funny way of looking at it, but I think we really do need to think about things like that and ask God for the wisdom of Solomon in making these decisions, and not just yakety-yak and talking and posturing and getting in front of a camera. I'm not being critical of any of my colleagues on either side of the aisle. I'm being critical of all of them. And I think they understand that. They know what I'm talking about. So this conservative Republican knows that you can't cut the CDC and these budgets to the bone, and I hope we're not going to do that. Thank you all for giving me the opportunity to speak with you this morning. It's a great pleasure of mine. Thank you.